The official you just heard speak, Centers for Medicare and Medicaid Administrator Dr. Mehmet Oz. Dr. Oz, thanks for being here on the show. So first of all, just tell us how this site, TrumpRx, is different from other cash pay discount sites like GoodRx.
Well, these are U.S. government negotiated most favored nation prices. Let me explain what that means. Generally, in America, until just now, we would pay on average 3 times more for every medication we were taking, even if it was made in a U.S. facility, than they paid for that same drug over in Europe or in Asia. Doesn't make any sense. You might wonder, how's that possible? Folks were getting away with it, so they charged. The president came in and said, we're not going to tolerate that anymore. Confront these pharmaceutical manufacturers face to face, look them in the eyes and say, this is not fair, it's not right. There's global freeloading on American taxpayers. We're going to make the prices fair, and that's called most favored nation pricing. We negotiated it all, but how do the people of America get those prices? TrumpRx.gov is that solution. It was built by Joe Gebbia, who built Airbnb. The wonderful engineer Ed Kornstein actually made the software, which is why the site is working so beautifully. And it is an elegant solution to the problem facing so many Americans, especially cash-paying Americans, folks who don't have great insurance, folks who can't afford asthma drugs, insulin, they can't get the fertility drugs. 1 in 3 babies, families are underbabied. How do they make children if they can't afford the medications? And with 90% discounts, we have an ability now to completely reset expectations for the American people and be able to save money while also saving lives.
And as you point out, the site works by targeting people who are willing to pay cash for their prescriptions rather than insurance plans. But it's unclear if all of the patients, especially those with insurance, will see cost savings from the site to buy their medicines. For Americans who are paying thousands of dollars in insurance premiums each year, what do you say to them?
Well, the best disinfectant is sunlight, transparency. And this is a big part of our hope with the great health care plan. Make it easy in plain English to understand what you're really getting. Now that everyone knows the true worldwide most fair nation drug prices, it's going to allow employers, insurers, and everyone in between to be able to take out the middlemen and drive those prices down. But our primary concern was for a couple groups. We wanted people on Medicaid. We wanted state governments to get inexpensive drug pricing. We want to make sure all the cash pay patients can now get these medications. Well, if you want to go on a GLP-1 drug, a weight loss drug, and you just announced, and I'll share this and make sure everyone understands it, these aren't just shots, they're pills now.
Like Ozempic or Wegovy.
Exactly. Now, Pam looks like a gazelle. You probably don't need it. But there are plenty of people who need these medications desperately and they can't afford them. The number 1 zip code for these GLP-1 drugs is Upper East Side of Manhattan, because people have money. Why can't folks in the South Side of Chicago or folks living in poverty in rural America get access to these meds? At $150 a month, not only can they get them, if they want to buy them on their own, they can. And here's the best part. Within 2 years, we will save money for the taxpayer, because when you reduce obesity rates, you reduce high blood pressure and diabetes and all the downstream illnesses, heart disease, kidney disease, brain disease, and now you're spending less money dealing with chronic illness because people are healthier and they feel better.
Yeah, and certainly I think a lot of Americans welcome lower drug prices. That is a big deal. But of course, you know, you have to look at the bigger picture too, right? I mean, you mentioned more families having kids. This could help with that. But then child care costs, of course, are a factor. Health care costs, a factor. I know the Wall Street Journal is reporting that you've held frequent talks with the president about health care in the U.S. I want us to take a listen to Republican Congressman Greg Murphy of North Carolina questioning health insurance CEOs during a hearing last month. He was really fired up. As you may know, he was a physician for more than 30 years. Let's listen.
But you all have been very derelict in your duty and abused this position of authority. There has been systematic denial and delay of care. It took me 8 denials myself to get a medicine that I need to exist. A year and a half. I'm a physician and a member of Congress. It took me 8 times through CVS to get that medication. I didn't pull any strings. I did what I was supposed to do. Imagine the average person in the country.
I know, again, you talked to the president. Does he recognize what the congressman had to say about insurance company and how they might take advantage of the average American, and what can be done about this?
The president not only recognizes it, he's actually started doing things about it. And I'll give you one concrete example, which is, I think, a differentiating element of what the president's been able to do. He believes in the power to convene. He's a deal maker. You bring people together who normally wouldn't talk to each other, and you tell them to put their swords away, sheathe them. That's what meek means. Put the sword away and actually talk. He asked us to go to all the insurance companies, and Chris Klump did this for us. He runs Medicare. And he got them all to say, listen, this does not work when you do prior authorization the way that Greg described. By the way, he still practices urologist. And so what he's describing is a real lived experience for him. And we got all these companies to agree that by the end of this year, they're going to deal with the prior authorization crisis. Prior authorization, again, you're having a precious discussion with your doctor. The insurance company puts their long arm in there, interferes with that sacred conversation, and then that covenant gets violated. From now on, they're going to rapidly, like hopefully real time, say yes or no to a treatment, come up with better ideas for how to actually use the system. We need some element of prior authorization because it does reduce wrong procedures, things that shouldn't be done. But I'll give you an example of an idea that's been come up with, again, by industry that we support. Gold carding. What does that mean? If you're an insurance company that does not interfere with a doctor because the doctor's so good he doesn't need it and your patients are getting great care, they automatically have to get to take whatever care they want. No one interferes. No delays on prescriptions or treatments. However, if you got a problem, you don't get that gold card. Now all the doctors want to get the gold card. Why? Because every doctor I know of wants to be in the top half of his class. We all think we were, by the way. And patients, more importantly, can pick the doctors based on who does better following evidence-based guidelines. This is a crisis that we can handle, and we've got our arms around it. And ones like that should be addressable, and we're going to make a lot of noise until we fix them. The president will not tolerate being second best, whether it comes to drug prices, prior authorization, or half a dozen other issues, like when you get confused almost on purpose by the reports you get from hospitals and insurance companies. That's part of the Great American Health Plan. We're not going to allow that to continue.
Earlier this week, as you well know, you drew some sharp criticism when you said kids should work right out of high school. And older Americans, you said, should put off retiring by a year to help get rid of the national debt. Let me play a clip for our viewers of that. Listen to this.
If we could get the average American, because they feel healthy, they're vital, they're strong, they have agency over their future, to start working a year earlier, right out of high school, or work a year later, not retire, or work better during their lifetime because they're healthy, it would generate about $3 trillion. $3 trillion to the U.S. economy. That would more than remove the debt.
Why should average Americans have to pay for problems created by Washington? And you concede that the national debt could also be eliminated by taxing the ultra-rich.
There are many ways of dealing with the debt, but ultimately my agency, CMS, we don't just regulate, we're the payers. And we should be using the money we pay out to save lives and improve the quality of life of the American people by making them healthier. If we do that, we unlock, Wolf, the greatest asset we have as our people. Right? It's not the energy we have under our turf. It's not all these other things we might quibble about. It's the people of America that are our richest asset. If we make our people healthier, they'll want to participate in life. You shouldn't work longer because you have to. You should work longer because you want to. You should retire, but you won't. Why not? Because you love the job and you're good at it.
You shouldn't retire.
No, I know. No, in theory.
I still wake up every morning and look forward to reporting the news.
That's it. That's what you want. You want to be here because you love it. If people get out of high school and we don't hold them back from being able to get a job and get involved in the work economy, if we don't provide ways for folks to leave the workforce, or they're forced to because they don't feel well because we're making them healthier, and if they want to work longer into their lives, I don't want to retire. I'm 65, right? Why would we retire? We want to do more, and we want to live the dreams that we still have. And that's what America should seek. If we took the average retirement age from 62, right, not because you have to, not by a law, not because Washington says it, but because you don't want to stop working, that's a great thing. And we generate so much value for the economy. It happens to solve the deficit. That's not the greatest.